Hello, YouTubers. It's yours truly, Michele Cuke, Student Midwife, today to talk to you about the pros and cons of a water birth. I had a water birth for my third baby, and it was wonderful. It was warm, it cut down on the pain. I felt like I had privacy, and it was just a really surreal experience. But let's see what the books and the literature says about the pros and cons of a water birth. So let's look at the pros. Pain relief, so it can help to decrease the pain in labor. It helps to relax you. It encourages effective contractions. It may shorten active labor. So active labor can be the hardest part, and it can shorten that time. And the buoyancy of the water really helps to just support your body weight. So it's not as much stress on your joints, and being upright isn't as difficult. In fact, it facilitates an upright position. It reduces perineal trauma because there's not as much pressure. The warm water can relax that perineal tissue. So it can help there. It enhances a sense of self-control because you have your little space, you're in your pool, you can decide where you want to be, what position you want to be in. It's really nice in that way. Provides privacy. Your perineum isn't out where everybody can see it. Lowers the stress level because it's more relaxing. It's good for the baby too. It helps the baby transition to the extra uterine life. It reduces the stress response for the baby. It helps with decreasing heat loss for the baby as well. And if you have back labor, it can really help with different positions and, the buoyancy of the water and just kind of decrease the discomfort of back labor. Some of the cons. So it's not appropriate for everyone. If there's a complication in the birth, if the preterm birth, some other things, slipping and falls. I mean, I have never witnessed that, and I have been to quite a few water births, but getting in and out of the pool, there's a possibility of injuring yourself, slipping. If the pool wasn't cleaned properly, there's a possibility of infection. Drowning of the baby, that's really, really rare. Once that baby comes up out of the water, you can't put it back down. So that's important as well. Monitoring the fetal heart tones is a lot harder. You have these Dopplers that can work in the water, but it's just a little bit more difficult. And if there's a complication with that heart tone, being able to detect it quickly is important. Water temperature, can be a challenge. It could be too hot. Then the mother's heart rate goes up, and then you cause the fetal heart rate to go up. It could be too cold for the baby, and then you've got stress. So the temperature, keeping it steady, keeping it at the appropriate temperature can be challenging. Rapid transfer. So if I need to get you out of the tub and get you onto the bed because I need to do something, or get you, to the hospital, it's a little harder getting out of a tub, right? And then you need providers that are comfortable with that. So there you go, pros and cons of a water birth.